Every day, more than 500 men, women, and children are treated in the emergency departments at William Osler Health System's Brampton Civic Hospital and Etobicoke General Hospital. We are, in fact, the busiest emergency service in Ontario. When you visit our emergency departments, our top priority is to provide you with safe and compassionate care and to get you the care you need as quickly as possible. How long you spend in the emergency department depends on a number of factors. How many seriously ill patients are being seen in the department while you are there, including those arriving by ambulance. How many tests you might need, for example, blood work, x-rays, or a CT scan, and whether a consultation with a specialist is required by your emergency doctor. All these things take time and will have an impact on your length of stay. When you walk into the emergency department, you will be welcomed by a nurse at the greeting desk. Even though you might be first in line, there may be other people in the line behind you who are more seriously ill than you are and who will need immediate attention. The nurse will decide who should be seen first based on the seriousness of each person's illness or injury. Daniel injured his arm at soccer practice. It might be broken. Jasmine has arrived in the emergency department complaining of abdominal pain. It could be serious. Samir is experiencing chest pain and pain in his left arm. He might be having a heart attack. In this case, even though Daniel and his mother were first in line, the nurse has determined that Samir's chest pain is serious enough that it requires immediate attention. So she takes him to the triage assessment room for an electrocardiogram, commonly called an ECG. The triage nurse will review the ECG and will also take Samir's vital signs like blood pressure and temperature. She will share the ECG with the emergency room doctor to determine the next steps in Samir's care. Jasmine is asked to take a seat in the waiting room area, where she will wait until her name is called to see the triage nurse. And Daniel and his mother are directed to the urgent care center inside the emergency department. The center is an area of the emergency department at Brampton Civic Hospital that provides prompt medical attention for minor illnesses or injuries that are not considered life-threatening. Depending on whether Samir's ECG is normal, he will either be sent to the registration area to confirm important personal information or to the resuscitation area in the emergency department. The emergency departments at both hospitals use special patient care areas like urgent care, subacute care, and the ambulatory treatment center, or ATC, to connect patients with the right care in a timely manner. Daniel and his mother meet with the registration clerk in the urgent care center and are then asked to take a seat in one of the treatment rooms. Jasmine's vital signs are taken by the triage nurse while she asks her a few questions about her medical history and current medications she is taking. Jasmine then meets with the registration clerk, who confirms her name and address and other important personal information. She is then given directions to the ATC area in the emergency department. When she arrives, she places her chart in a bin on the wall and takes a seat in the waiting room. In the cardiac assessment zone of the emergency department, a nurse conducts a nursing assessment with Samir and connects him to a heart monitor. The doctor talks to Samir about his symptoms and, based on his feedback, orders blood work for specific heart testing and a chest x-ray. As soon as an x-ray machine is available, the nurse takes Samir to get his chest x-ray. It can take several hours before the results on Samir's blood work and chest x-ray are ready. During this time, Samir will remain in the cardiac assessment zone, where he will have frequent reassessments of his blood pressure and heart rate and will be asked about changes in his condition. The ATC is busy. After waiting for an hour, Jasmine is seen by a doctor for an initial assessment. He orders blood work and an ultrasound. After taking her blood for testing and starting an intravenous, the nurse arranges for Jasmine to visit the X-ray department for an ultrasound. If the ultrasound is busy with other patients, Jasmine may have to wait a while before they can run the test. In the urgent care center, Daniel is being seen by a nurse. Based on feedback from the doctor who has reviewed Daniel's chart, The nurse checks his temperature, pulse, and breathing rate. The doctor arrives and talks to Daniel and his mom while looking at his arm. She orders an X-ray. After the X-ray has been taken, Daniel and his mom will have to wait for the results. Regardless of where you are being seen in the emergency department, please feel free to ask the staff questions about why you are waiting, about your care, and what you need to know before you go home. This will help us better address your concerns while you are here. After reviewing the X-ray, the doctor realizes Daniel has a broken wrist and asks an orthopedic technician to stabilize Daniel's arm with a cast. Daniel's mom is given an appointment to bring her son back to the hospital's fracture clinic in a few days' time to reassess the wrist and determine next steps. A volunteer arrives to ask Daniel's mom a few questions about her experience in the emergency department. This feedback is important and helps us to improve the care we provide. After 4 hours in the emergency department, Daniel and his mom are ready to leave the hospital. Meanwhile, the doctor discusses the results of Jasmine's blood work and ultrasound with her. He wants to start her on morphine to see if it helps relieve her abdominal pain. Jasmine is moved to a seat in another treatment area and waits for the medication to take effect. The doctor reviews Samir's blood work with him, but is still awaiting the results of his chest X-ray. It has been 7 hours since Jasmine arrived in the emergency department. After monitoring the effects of the morphine on her stomach pain, the doctor is ready to discharge Jasmine home. Before Jasmine leaves, one of our volunteers drops by to ask her a few questions about her stay. With a prescription from her doctor in hand, Jasmine leaves the emergency department to go home. Based on the results of Samir's blood work and X-ray, he is given medication. He will remain in the department so that the doctor can observe the effects of the medication on his condition. The doctor returns to talk to Samir about his condition, gives him a prescription, and tells him what steps to take when he returns home. With his visit to the emergency winding down, our volunteer meets with Samir and asks him questions about his experience. After 8 hours in the emergency department, Samir and his wife are on their way home. Please remember, everyone's wait time in the emergency department will be different depending on your care needs and the number of tests you need. Our staff is doing everything possible to get you the care you need as quickly as possible. Whether you arrive at our emergency departments on foot or by ambulance, and whether you need emergency or urgent care, our healthcare professionals will support you with the best possible healthcare. For more information, please visit our website at www.williamoslerhs.ca.